We interrupt this program to talk about the medical and ethical implications of the measles vaccine.
The MMR vaccine protects from the measles, mumps, and rubella, and it is recommended for all children. But a study done in 1998 providing false information by fraud, Andrew Wakefield, alluded that the vaccine would essentially cause autism. People began to question how seriously to take the recommendation to vaccinate their children, not knowing that the absence of the vaccine was causing a higher risk of the measles itself. This raises the question, what happens when a child is not vaccinated?
Today, the measles virus hits about 60 people per year in the United States, and even though vaccination rates increase after recognizing the false information, it still kills more than 100,000 people a year in the world. Although this is a definite step up from the 400,000 cases previously reported in the pre-vaccination period, 100,000 lives lost is still too many. It was proved that in the past, nearly 100% of the population had been infected, but with the luxury of the vaccine, that rate had been reduced by 99%, with only 95% of 12-month-olds and 98% of 15-month-olds receiving the vaccine.
The 5% of unvaccinated 12-month-olds thank the idea of herd immunity for not contracting the virus, because it takes 95% of the population to receive the vaccine in order to prevent the virus as a whole. That being said, any amount larger than 5% of unvaccinated children causes the virus to spread again. So, how does the virus actually spread?
It is considered highly contagious and is transmitted through the air we breathe. All it takes is to be within the close vicinity of an infected person. The virus is replicated in the throat and mouth, transmitting just by coughing, sneezing, or even talking. The infection can be inhaled, and if landed on a surface, they can remain active and contagious for up to 2 hours, in which time they can spread to a person's eyes, nose, or mouth by touch. Symptoms typically appear 10 to 14 days after the virus is contracted, including fever, dry cough, runny nose, sore throat, inflamed eyes, unusual spots inside the mouth, and a severe skin rash. When deciding whether or not to vaccinate your child, you should also take into consideration the ethical implications like taking responsibility for your actions, empathy for others, and human rights.
Imagine a scenario where you choose not to vaccinate your child because of the false allegations made in 1998. Your child then contracts the measles virus, leading to not only the sickness of your own child, but the possible rapid spread of the virus to your child's loved ones, putting yourself and your family at high risk. You are now obligated for caring for a sick child and must take responsibility for increasing the risk of death for not only your child but the surrounding population. Because herd immunity is only effective with a 95% vaccination rate, any amount below that can, and most likely will, start an epidemic.
Should the parents of these children even have the option to not vaccinate? Under the rights given to us in the Declaration of Independence, we are entitled to a basic right to life. This means that it is morally wrong for people to kill one another, and that people are responsible for saving one another if a person is at risk. Therefore, it must be decided. Is not having your child vaccinated a risk to others? Although we have our personal freedoms of what we can and cannot do in America, having the option of the MMR vaccine should be taken into consideration as one of these freedoms, as it more so impacts our rights.